Healthcare is another difficult challenge in the remote areas of Nepal. Among the many exciting and ambitious projects underway is the DCWC Nepal's medical centre cum hospital. After lengthy research into health issues in Nepal's rural districts, the DCWC is committed to building a facility which will enable the poor, remote communities to benefit from healthcare for the first time.
त्यो दरगाहबाट यहाँसम्म आउनलाई कति टाइम लाग्छ?
लाग्छ नि बिहान पौने 8 तिर हिँडेको यहाँ 12 बजे पौने 12 मा आइपुग्यो. पौने 12 भने चाहिँ 8 9 10 11 12 5 घण्टा लाग्यो हैन? हजुर. Okay, I asked to her, how long does it take to come from home to the, the small health place? So she said it is about, it's the 6 hour. His baby has a problem of the, diarrhea problem. There is a small medical store. They supply some medicines. But even in there is not a doctor. So this lady who know a little bit about the medicine, they gave the medicine. She gave her some liquid medicine for the baby. Many of the hundred of women, thousand of people is having problem of the health in all that area. They have to come in here. Even when they came in here, sometimes medical store is closed because of they don't have enough medicines. So if the medical store is closed, then they have to walk 6 hours coming here and 6 hours to go in there, which is pretty difficult to them. Not only the heart problem, then is the thousand of women has is the same problem, is for baby. They have only the one way, is if this small medical center provided the medicines, then they can save the his life.
Sickness and diseases like TB, polio and cholera are responsible for a staggeringly high percentage of fatalities in Nepal. Many of the illnesses suffered are due to small infections not being treated in time, or even identified at all, due to the lack of proper health care, something we in the West take for granted. The DCWC Nepal has spent the last few years speaking to senior health workers to ascertain health areas which need boosting and communities most vulnerable. Here are some of their views.
When we intervene, when we launch this program, in that period we will give awareness program to the people in every aspect which is related to the health. When people know about the health, then automatically preventing getting sick.
As tuberculosis has been a big public health problem in Nepal, still 5,000 to 7,000 people are dying every year with tuberculosis. Still 40,000 new cases added up every year. Our expected prevalence of tuberculosis is nearly 80,000 all over the country.
In the rural area, there is no enough facility. About 60 to 80,000 people, new people are getting infection per year. When we start this project, we develop the treatment center. We can save not only the people who are dying with TB, but also we are save their life, those who are getting infection from other condition also. After launching this program, we can save 5,000 people's life per year.
Another area of investigation is the rural communities themselves. In 2007, the DCWC Nepal used a 4-day school opening festival to find out just how much medical care was needed in the area. 6 doctors and 2 dentists were taken over together with enough medicine to treat around 1,500 people. The newly built Churikola school was used as a makeshift medical centre for the duration of the festival, and the exercise was to prove most enlightening. Over the 4 days, no fewer than 2,400 people attended, were diagnosed and either administered the correct medication or referred to the nearest hospital. With the DCWC doctors working from 6 a.m. till late in the night, it was possible to ascertain the scale of help needed in the area. Armed with the information from medical authoritarians and fieldwork in the vulnerable districts, The DCWC can now put into motion the building of a suitable medical facility to cover this area. This three-phase project will involve the building of a 2-storey medical centre as the first part, and this will contain doctors' surgeries, treatment and waiting rooms, a pharmacy, and staff accommodation. The second phase will be the building of a third tier, which will be used to accommodate visiting doctors from the west. And finally, the third phase will be the addition of 5 more rooms, which will act as the hospital section, containing 50 beds. With substantial funds in place to begin the first phase, the DCWC Nepal begins building in 2008, and the centre is scheduled to open in 2009. If you're interested in supporting the DCWC Nepal in this or any other project, please use the contact details at the end of this film. With your help, some of the diseases which have already been eradicated in the West can be cured in Nepal too.